So chapter 8, Pathophysiology. The National EMS Education Standard Competencies for this chapter, Pathophysiology, integrates comprehensive knowledge of pathophysiology of major human systems. And I always think about pathophysiology as abnormal functions of a system. So introduction. Pathophysiology is the study of altered functions within the body when a disease is present. Or as I put it in layman terms, abnormal function of a system when something is wrong. It doesn't necessarily have to be specific to disease. It can be a physical injury that has occurred to that particular system that is causing an abnormal function. Now, cells go through adaptation. So adaptation in cells and tissues. Cells undergo adaptation when exposed to adverse conditions. And so you have atrophy. Cells can go through atrophy, hypertrophy, hyperplasia, dysplasia, metaplasia. Atrophy is when a tissue or organ decrease in size because it's not being used as much as it used to. So it decreases in size, and as it decreases in size, it decreases in function. Hypertrophy is an increase in the size of the tissue or organ. Can be because it has to work harder to carry out a particular function. Hyperplasia is the increase in the production of cells. So it's an increase in the production of cells. Dysplasia is the abnormal production of cells. So it's an increase in the number of cells, but it's abnormal. That's dysplasia. Dysplasia can lead to cancer forming. Metaplasia is when one cell type is replaced by another cell type. That's what we call metaplasia. Now, disturbances in fluid balance. Majority of the body is water, right? For adults, it's 60% of their body mass. For the pediatric population, it's higher. So it's actually higher. The majority of that water, or majority of the water in the body, is found in the cells. The rest of it is found in the intravascular space and the interstitial fluid. And there are electrolytes or processes in the body that allow the fluids to shift from various departments depending on which electrolytes or nutrient needs to be either in or outside of the cell. If this balance is disrupted, then it can lead to abnormal fluid shifting, which can cause problems with water, and it can cause problems with electrolytes. So disruption of homeostasis can cause or exacerbate various disease processes within the body. Changes in fluid or electrolyte balance. It can be linked to changes in fluid or electrolyte balance. The degree of fluid imbalance will depend on the size of the patient, the age, and whether or not they have any medical condition. And an electrolyte is an inorganic molecule. That's what an electrolyte is. A molecule is said to be inorganic if it doesn't have a carbon atom. So if it doesn't have a carbon atom, it's said to be inorganic. An electrolyte doesn't have a carbon atom, and an electrolyte can conduct electricity when it dissociates in water into what we would call its ionic form. So that's why it's called an electrolyte. And they fall in two groups. They fall in a group which classifies them based on a positive charge or classifies them based on a negative charge. So you have positive electrolytes and you have negative electrolytes. The positive electrolytes are referred to as cations, or as I sometimes pronounce it, cations. That's your positive. The negative electrolytes are the anions or anions, as I sometimes refer to them as. And these electrolytes are important to a lot of functions within the body. So they play a role in water regulation, cardiac function, and muscular contraction. And they also play a role in how our cells will utilize certain nutrients. Now, edema, swelling. Edema, swelling caused by excessive fluid trapped in the body tissues. Causes include capillary hydrostatic pressure. Now, when you see the term capillary, well, don't even focus too much on the capillary part. Hydrostatic pressure, think of it as pushing pressure. So that's pushing pressure, pressure required to push fluid through a vessel. That's what we call hydrostatic pressure. The osmotic pressure is the pressure that is exerted on a protein, right? So it's the pressure that is exerted on a solute to keep water in an area. So osmotic pressure would be pulling pressure. Hydrostatic pressure is pushing pressure. Osmotic pressure is pulling pressure. If there is alteration in these pressures, meaning if there's an increase in the capillary hydrostatic pressure, which is pushing pressure, then it can push the fluid into areas that it's not supposed to go. If there's no pulling pressure to keep the fluid in a particular area, then the fluid will also shift, and that can cause edema. Also, if the lymphatic vessel is obstructed, then the passive flow of fluid in the lymphatic system is going to be backed up, and that creates a back pressure, and fluid can end up in places where it's not supposed to be. And sometimes you will see the term third spacing. Now, what third spacing means is that the fluid is in a compartment or area of the body where it cannot participate in normal metabolic function. That's what we call third spacing. So when fluid is pushed from its normal area where it can cause normal metabolic function into areas where it cannot, that is referred to as third spacing. Now, in order to keep fluid in the various areas of the body, the cell, interstitial space, and the intravascular space, the hydrostatic pressure must be appropriate and the osmotic pressure must be good as well. So these two pressures work together to keep fluid where it needs to be inside of the body. Now, an isotonic fluid deficit. A patient can have an isotonic fluid deficit or they can have an isotonic fluid excess. Now the difference is with isotonic fluid deficit, it means that there is a loss of sodium, and sodium and water work together. Anywhere sodium goes in the body, water is going to follow it. So if there's a decrease in sodium, there's going to be a decrease in water. So water is going to be lost wherever that sodium goes. And that would be an isotonic fluid deficit. Because sodium is an electrolyte that is primarily extracellular. It is loss of extracellular fluid. So that's the fluid outside the cell. Because sodium is primarily outside of the cell, right? That's where it functions primarily. Now for isotonic fluid excess, it means that there is too much sodium in the extracellular fluid. And if there's too much sodium in the extracellular fluid, then you're going to have too much water as well, because it's going to pull water to where that sodium is. And sodium is a positive electrolyte. So it is a cation or cation, as I would refer to it. And here we go. So I've already explained to you what an electrolyte is. So let's just go through the different types of electrolytes, the ones that are really important, and the ones that you need to really pay close attention to is sodium, potassium, calcium, magnesium. So sodium, which is a positive electrolyte, regulates fluid balance and total fluid volume and blood pressure. It is also very important to the sodium-potassium pump, which is important to your cardiac cells. That's how the cardiac cells will become depolarized or discharged. And it is primarily higher in its concentration outside of the cell. And its main function is going to be water regulation. And it works closely with chloride. So hypernatremia is a serum. When you say the term serum, it's referring to the blood. Is a serum sodium level of, I would say, 145, not 143, 145 milliequivalent. And milliequivalent is the unit of measurement for electrolytes. It has to do with their chemical combining power based on their ionic charge, whether they have one charge or two charge. So milliequivalent, if the sodium level is higher than 145, that's hypernatremia. If it is lower than 135 milliequivalent per liter, that is hyponatremia. So that's low sodium levels in the blood. Very important slide. Now, potassium. Potassium is primarily higher in its concentration inside of the cell. So it's crucial to many cellular functions. It plays a role in neuromuscular function and the conversion of glucose to glycogen. It also regulates, it helps to regulate insulin. So that's potassium, right? It helps to keep water inside of the cell as well, but its most important role is neuromuscular function converting glucose to glycogen and regulating insulin, and it is crucial to the sodium potassium pump, which is necessary for the cardiac cells to depolarize. So potassium is crucial to many cellular functions. The normal serum level is 3.5 to 5.0 milliequivalent per liter. Hypokalemia is decrease in serum potassium level, and hyperkalemia is an elevated serum potassium level. Now, whether the potassium level is significantly high or low, it's going to cause serious cardiac problems. It can cause serious complications with the kidneys, and it can cause serious cardiac issues. A matter of fact, potassium is an agent that they use to execute prisoners, so it should never be given directly through an IV. It can kill persons, and it can kill quite quickly. All right, now calcium. This is the principal electrolyte needed for bone growth. It also plays a role in the function of the heart muscle, and it is important to nerves and cell membrane. It also plays a role in clotting, so it's very important, right? But the major function of calcium, bone growth, important to the heart muscle. So without calcium, the heart muscle cannot contract. So it's important to muscle contraction. It is important to the nerves and the cell membrane, and it has a role to play in clotting. The normal serum level is 8.2 to 10.2 milligrams per deciliter. Hypocalcemia is decreased serum calcium level. Hypercalcemia is increased serum calcium level. Now, if there's too much calcium in the blood, it means that there's not enough calcium in the cell, and that can decrease the cellular function or cellular contraction. If there is too much calcium in the cell, then that will overstimulate. That can result in the cell becoming overstimulated. Right, and this chart right here shows what will happen in certain areas of the body when there is a low blood calcium level and when there is a high blood calcium level, and how it is corrected. Make sure you pay attention to that one when you're doing your in-depth reading. All right, now phosphate. Phosphate is essential to cellular function. So that's where phosphate will be most important. And let me just backtrack for a bit. So sodium, potassium, and calcium are positive electrolytes. They are positive. Phosphate is negative, or phosphorus. Now, phosphorus is important to cellular function. Without phosphorus, the cells cannot create adenosine triphosphate, which is necessary for a cell to create the energy that it needs to carry out its normal metabolic function. So it's very important to cellular function. Hypophosphatemia is decreased level of serum phosphate. Hyperphosphatemia is increased level of serum phosphate. All right, Now, magnesium. And magnesium is positive. Magnesium has an important role as a coenzyme in the metabolism of protein and carbohydrates. And it is similar in function to calcium in that it can trigger or control neuromuscular functions or contraction. Okay? But it helps in the metabolism of protein and carbohydrates. 50% is stored in the bones, 49% is in other body cells, and 1% in extracellular fluid. Normal range of serum is 1.3 to 2.1 milliequivalent per liter. And remember, when you say the term serum, we're talking about the blood. Hypomagnesemia or anemia is decreased level of serum magnesium. Hypermagnesemia is increased level of serum magnesium. And because it is so important to the metabolism of protein and carbohydrates, it means that if your patient is malnourished, they can have a deficiency with magnesium, and that can, if they go into cardiac arrest, they can develop a polymorphic ventricular tachycardia, which will require magnesium sulfate to treat. Pregnant females also develop deficiencies with magnesium, and that's why if they're having eclamptic seizure, then magnesium might be a treatment that is given, or magnesium is a treatment that is given to that patient. Now, disturbances of acid-base balance. pH. pH refers to the power of hydrogen. So the more hydrogen present, the more acidic. The less hydrogen present, the more alkaline the solution will be. So pH is a measure of the acidity or alkalinity of a solution. Lower the pH, the higher the acidity. Disturbances of acid-base balance are associated with disturbances of potassium balance. Now, we need to have a state of balance within the body, and a normal pH for the body is 7.35 to 7.45. And it's very intricate in its regulation to maintain that balance. If the pH goes below 7.35, then the pH is more acidic. If the pH goes above 7.45, then the pH will become more alkaline. And depending on which direction the pH moves, the body will trigger mechanisms to regulate it. So extremes in terms of acid-base balance will be linked to either acidosis or alkalosis. When there is acidosis or alkalosis in the body, it will be linked to either a respiratory problem or a problem with the kidneys. If it is linked to a respiratory issue, then it means that the patient can have respiratory acidosis or respiratory alkalosis. If it is linked to the kidneys or a metabolic issue within the body, then the patient can have metabolic acidosis or metabolic alkalosis. Now, if a patient is in respiratory acidosis, it means that the patient is ventilating too slow. If they are ventilating too slow, it means that carbon dioxide is building up within the body, and that's going to form carbonic acid when it combines with water. For the body to be able to balance that out, the body would have to remove hydrogen in the urine. So the body is going to remove hydrogen through the urine. And that process would be called metabolic alkalosis. So the body is going to get rid of hydrogen to get a state of balance. If the patient has respiratory alkalosis, it means they are ventilating too fast. If they are ventilating too fast, it means they are breathing off too much carbon dioxide and the pH is going up. The body is going to try to balance that by retaining hydrogen. So instead of releasing hydrogen in the urine, it's going to retain hydrogen. And by retaining hydrogen, that process would be called metabolic acidosis. So if it's respiratory acidosis, the body corrects it with metabolic alkalosis. If it is respiratory alkalosis, the body corrects it with metabolic acidosis. That's how the body maintains balance. So respiratory alkalosis is associated with hyperventilation. Metabolic alkalosis occurs due to an excessive loss of acid. Any acidosis unrelated to a respiratory system, any acidosis unrelated to the respiratory system would be considered metabolic acidosis. Right? And that's your acid-base balance. Now, cellular injury. Various processes may cause cellular injury. It can be as a result of hypoxia, which is a lack of oxygen, can be due to ischemia, which is an issue with blood flow, reduction in blood flow or supply, can be as a result of a chemical injury, infectious injury, immunologic, which is a hypersensitivity issue, physical damage, mechanical injury, or inflammatory injury. And how the body's defense work is the first line of defense is the skin. Then after that, it's to some extent, the mucous membranes and some aspects of the digestive system. Then you have the inflammatory defense. And then the third line of defense is the immune response. So it's the skin, inflammation, immune response. That's the body's defense. Now, manifestations occur at microscopic functional levels. So a cell goes through normal cellular death. So most cells in the body is going to go through a natural process of cellular death once it carries its task. So it keeps replicating until none of it remains, and then a new cell will take the place, and that's normal. So what picture A is showing is what it would look like if it is normal. What picture B is showing is if the cell death is abnormal, if there is abnormal cell death, right? Something that the body is not controlling as a normal process. Abnormal cell death, the cell explodes and it leaves a lot of granules, right? So there are some sediments or granules that remain, and these can cause problems with other cells within the body. So byproduct remains when it's abnormal cellular death, and it can cause complications with other cells and tissues. Now, hypoxic injury. Common cause of cellular injury may result from decreased amounts of oxygen in the air or loss of hemoglobin function, a decreased number of red blood cells, disease of the respiratory or cardiovascular system, or loss of cytochromes. Cells that are hypoxic for more than a few seconds produce mediators which lead to more cellular damage. Chemical injury. A variety of chemicals may injure and ultimately destroy cells. So cyanide will interfere with the oxygen molecules combining with the hemoglobin molecules. Pesticides will overstimulate the cholinergic system, and that will cause an overproduction of secretions in various systems within the body. Long-term ingestion of lead will affect the transmission or how nerves function, and it can affect the brain. Carbon monoxide will affect the oxygen combining ability to the hemoglobin, and high dose of ethanol. I don't remember what ethanol affects. It's slipping my brain at this point, but I'll double check and I will inform you. It's right at the tip of my brain, but I just can't remember ethanol. All right, infectious injury occurs as a result of an invasion of bacteria, fungi, or viruses. Virulence measures disease-causing ability of a microorganism. A depressed immune system is less capable of fighting off microorganisms. Viruses take over metabolic processes of the host cell and use the cell to replicate. So when the virus takes over the metabolic process of the host cell, it basically builds a virus factory, right? So it's going to create a virus factory to mass produce the virus cells. That's what it does. All right, hold on. Many bacteria have a capsule that protects them from phagocytosis, and this is when the white blood cells engulf and try to digest them or break them down. That's the process of phagocytosis. Now, the immunologic and inflammatory injury. Inflammation is a protective response in the presence of cellular injury. It can be triggered by physical damage, chemical, or microbiologic agent. And there are some key signs and symptoms that you look for to determine if inflammation is present. The area is going to get hot, it's going to get red, there's going to be tenderness, pain, and swelling. If the inflammatory process is severe, then the effects will become systemic. So if it's a severe inflammatory process, it becomes systemic. And this chart is just showing the process, right, of tissue injury and the mediators of inflammation. And mediators, just think of them as chemical agents that will trigger certain processes in the body. So there is a chemical agent, there is a physical agent, there's a pathogenic microorganism. Any of the three can result in tissue injury. When that tissue injury occurs, chemical mediators of inflammation are released. When they are released, it will cause the capillaries to dilate, and this will increase blood flow. It will make the capillaries more permeable for extravasation of fluid. It will attract white blood cells to the area, and it's going to trigger the production of more white blood cells. And with these chemical mediators being produced and their effects being initiated, that will result in the signs and symptoms that we observe: heat, redness, tenderness, swelling, and pain. Now, injurious genetic factors. An abnormal gene may develop by mutation of a gene during meiosis or by heredity as a result of other causes in later life. So a gene can mutate or become abnormal due to the cell not dividing or replicating properly. It can be something they inherited, or it can be as a issue they experience later down in life. Genetic factors that may damage cells include chromosomal disorders, premature development of atherosclerosis, and obesity. Injurious nutritional imbalances. Now, if there is issues with nutrition that can be linked to obesity. It can be linked to malnutrition, person not eating properly, can be as a result of vitamin excess or deficiency, or mineral excess or deficiency. Injurious physical agents or conditions. So conditions that can result in injuries to a cell: heat, cold, radiation, and heat, cold, radiation. The degree of cell injury is determined by the strength of the agent and how long that particular cell was exposed to it for. Now, apoptosis or apoptosis is what is referred to as normal cell death. So this is normal cell death. Part of normal development: organogenesis, immune function, and tissue growth. Proteins and DNA undergo controlled degradation that allows remnants to be taken up and reused by neighboring cells. Inhibition of normal course of apoptosis or apoptosis allows destructive cellular proliferation. And this is a diagram showing virus, radiation, chemical carcinogens, unknown factors that can affect a normal cell, right? And if the immune system is working well, then it will destroy that abnormal cell. But if the immune system is not functioning effectively to destroy that abnormal cell as soon as it is being replicated, or as fast as it is being replicated, I should say, then it will result in a cancerous tissue being formed. So it's the effectiveness of the immune system that will dictate whether it becomes cancerous or not. Now, abnormal cell death, this is what we call necrosis. So key points: Apoptosis or apoptosis is normal cell death. Abnormal cell death is necrosis or tissue death. So, result of morphologic changes that occur following cell death. Simple necrosis may be caused by acute ischemia, that's lack of blood flow, acute toxicity, can be exposure to some type of chemical that has some toxic effect, or direct physical injury, trauma. And then you have what is called derived necrosis, which is more specific, a more specific type or selective types of necrosis. You have caseation necrosis, which is the same as coagulation necrosis. So it has to do with coagulation. You have dry gangrene, and gangrene affects the skin when it is exposed to extreme temperatures of cold. That's gangrene. Then you have fat necrosis. Fat necrosis is common in women with large breasts. So the fat tissue, there is abnormal cell death of the fat tissue in the breast. It's not malignant, right? And that's fat necrosis. Liquefaction necrosis is when the tissue that dies breaks down into a liquid form. You will see that with patients who have fungal or bacterial infections. Now, hypoperfusion or shock. Perfusion delivery is the delivery of oxygen, nutrients, and the removal of waste by the circulatory systems so that the cells within our body can carry out their normal metabolic function. Hypoperfusion occurs when the level of tissue perfusion decreases below normal. Shock is an abnormal state associated with inadequate oxygen and nutrient delivery to the cell. Types of shock. Shock can occur as a result of inadequacy of a central or peripheral circulation. Now, central shock would be specific to cardiogenic shock and obstructive shock. Cardiogenic shock, the heart cannot circulate enough blood to maintain adequate peripheral oxygen delivery. So there's a direct issue with the heart. Obstructive shock, blood flow becomes blocked in the heart or great vessels. So something is indirectly affecting the flow of blood out of the heart. And with obstructive shock, it can be a cardiac tamponade, can be a tension, pneumothorax, or it can be a pulmonary embolism. Cardiac tamponade means there is fluid collecting in the pericardial sac that is obstructing the movement of the heart. Now, peripheral shock. Peripheral shock can be a distributive problem, or it can be a problem with fluid or blood. So peripheral shock is hypovolemic shock, which is the circulating blood volume is insufficient to deliver adequate oxygen and nutrients. And it can be exogenous or endogenous shock. Don't get too confused with those terms. All it means is that it can be hemorrhagic and non-hemorrhagic. So exogenous would be hemorrhagic. Endogenous, it can also be as a result of blood, but plasma loss, right? Now, the distributive shock occurs when there is widespread dilation of resistance vessels, capacitance vessels, or both. So distributive shock simply means that the blood vessels are too dilated. Anaphylactic shock, histamine, and other vasodilator proteins are released on exposure to an allergen. For septic shock, it occurs as a result of a widespread infection, and for neurogenic shock, it is the result of spinal cord injury. Now, management of shock. Most types of shock are characterized by reduced cardiac output, circulatory insufficiency, and a rapid heartbeat. Shock diagnosis. Evaluate the presence and the volume of peripheral pulses and assess end organ perfusion and function. Multiple organ dysfunction syndrome. Now, this is a progressive condition that occurs in some critically ill patient. Concurrent failure of two or more organs or an organ system initially unharmed, right? So it can be multiple organs shutting down and one organ system is still intact, or it can be the failure of two organs. Primary MUDs is direct result of an insult, such as a pulmonary contusion. So there is a direct issue. Secondary MUDs is slower, more progressive organ dysfunction. No, I didn't spend a lot of time on shock and MUDs because there's going to be a chapter that's specifically dedicated to that. So don't worry too much about that. Now, the body's self-defense mechanism. Remember earlier I said to you that we have the skin defense, the inflammatory defense, and the immune system defense. So the body's self-defense mechanisms. Immune system includes all structures and processes associated with the body's defense against foreign substances. Anatomic barriers decrease the chances of foreign substances invading the body, and that would be the skin, the saliva, and certain points where mucous membranes are present in the body. Immune response. The body's defense reaction to any foreign substance, and it can be natural immunity, which operates as the first line of defense against pathogens, and natural immunity is the same as innate immunity. Now, when it is natural immunity or innate immunity, it means that the reaction is sudden and it is not selective. So it's gonna react sudden and it's not selective. So it's gonna be the same reaction every time it occurs. It's non-selective. So it's immediate and non-selective. That is what you need to remember for natural immunity. Acquired immunity, the immune system recognized that the same stimulant was subsequently encountered. So acquired immunity is progressive and it's going to involve the immunoglobulins or immunogen antigens, and it will involve B cells and it will involve T cells, depending on where the invader is. So if the invader is in the tissues, it's going to be the B cell. Sorry, if the invader is in the fluid, it's going to be the B cells. It's in the tissues, it's going to be the T cells. Right? And acquired immunity is highly specific. So the reaction will be very specific depending on the invader. An immunogen is an antigen capable of generating an immune response. And you'll see the term immunoglobulin, which is the same as saying it's an immune antigen. And you have different immunoglobulins within the body, which are proteins or antigens that can trigger immune functions or responses. And the majority of the immunoglobulins in the body are highly selective, with the exception of probably one. Now, I'm going to go into the different types because you don't really need to know that at the AEMT level. You just need to understand that an immunoglobulin or an immunoantigen is a protein or antigen that can trigger a specific immune response. Now, this chart actually shows what would occur if the invader is in the fluid, right? It shows what would happen. And you can explore the details of the chart and learn more about it when you do your in-depth reading. I'm going to spend too much time on that now. Now, antibodies makes antigens more visible to the immune system. Very important statement. So antibodies make antigens more visible to the immune system. And antibodies are found in plasma. Antigens are on the surface of structures or cells, invaders or cells. Now, you can have cell-mediated immunity, right? Cell-mediated immunity. And cell-mediated immunity is going to be activated if the invader is within the tissues. As I stated before, if the invader is in the fluid, it's going to be the B cells, and it's going to be an antibody-antigen reaction when it's in the fluid. If it's a tissue issue, then it's going to be cell-mediated. And this is where we have the lymphocytes, right, going into work. So the formation of lymphocytes will occur with cell-mediated immunity, and this will destroy foreign material. Now, when there is cell-mediated immunity, the lymphocytes that are created are various types of lymphocytes. So you have killer T cells, helper T cells, suppressor T cells, memory T cells, right? Now, the helper T cells will activate other cells and the killer T cells. That's what helper T cells does. It activates killer T cells and helper T cells. And it activates other cells as well, which I won't get into based on the scope of this course. The suppressor T cell is present to prevent the immune system from overreacting. That's the purpose of suppressor T cells. They prevent the immune system from overreacting. The memory T cells record the structure of the invader, and then they will go into training and prepare, right? They're going to prepare B cells and put them in the plasma, that if it is encountered again, the reaction to it will be much stronger, or the defense to it will be much stronger. Killer T cells will do as they say. They will destroy invading viruses that are trying to create virus factories within the body. And the lymphokine are those chemicals that will cause specific reactions when released by the cells. And this chart, which I can barely see, I can enlarge it, but It shows an immune response. Again, when you're doing your in-depth reading and studies, you can spend some time and look at what happens as the cells start to replicate. So when it's cell mediated, the cells replicate, and they're going to replicate into various types of T cells, depending on what function needs to be carried out and when. Again, this is showing the immune response, and it's showing what happens when it's cell mediated and when it is humoral immunity. When you see the term humoral immunity, it means that the response is in the fluid or plasma. And if it's a plasma or fluid response, B lymphocytes are going to be the main cells that operate if it's humoral. If it's cellular, then you will get T lymphocytes, and they will replicate into various T cells: memory, suppressor, killer, helper, and so on and so forth. So just ensure that you know the difference between the cell-mediated immunity and humoral. All right, now inflammatory response. Response of tissues of the body to irritation or injury. Inflammatory reaction and immune response are independent processes. Acute inflammatory response involve vascular and cellular components. Polymorphonuclear neutrophils is just a fancy way of saying neutrophils. I don't know why they put these complicated terms sometime in these texts, but polymorphonuclear neutrophils is the same as saying neutrophils, right? So the neutrophils, which is a granulocyte type white blood cell, will arrive at the site of the injury. And there are phases. You have the intravascular phase, the intravascular phase, and the extravascular phase. The cellular event sequence will include margination, activation, adhesion, transmigration, and chemotaxis. And all that is saying is these are the chemical processes that will occur when the cells migrate to the area. They will activate. There is adhesion to the area of injury. Transmigration will occur, and the area is sealed off. Cellular products of inflammation include cytokines, interleukins, interferon, and lymphokines. And these are chemicals that will trigger all the signs and symptoms that you see when a patient is having an inflammatory process. So these chemicals will trigger heat, will cause heat or fever. They will cause swelling, tenderness, and pain. Now, normal wound healing involves repair of damaged tissue, removal of inflammatory debris, restoration of tissue to our normal state, and regeneration of cells. Factors that can lead to dysfunctional wound healing may be localized or they can be systemic. Now, variances in immunity and inflammation. So hypersensitivity is a response of the body to any substance to which the patient has increased sensitivity. And the hypersensitivity can be of 4 different types. So you have type 1, type 2, type 3, and type 4. The one that you would be most familiar with is type 1. So type 1 is what is triggered when a patient is having an allergic reaction. Type 1 is where histamine will be produced. Type 2 is a cytotoxic hypersensitivity, right? So that's more of a tissue hypersensitivity or serum hypersensitivity. So like somebody doing a blood transfusion, they can get type 2 cytotoxic hypersensitivity. And the term cytotoxic means is another way of saying cell death. The type 3 now. Type 3 is your immune complex. So that's where we're talking about antibody and antigen reaction. So it's going to be more of a systemic chronic disorder. For instance, rheumatoid arthritis, where the body is basically attacking itself, right? So it's more systemic. And then your type 4 is delayed cell-mediated hypersensitivity. This is more of a local hypersensitivity. So it's very specific to an area within the body or a cell, a specific cell within the body. But the main one that you're going to be encountering in the field is going to be the type 1. Type 2 is going to be for persons who are doing blood transfusion, organ transplant. They will develop that type of hypersensitivity. And type 3 are persons who have conditions in which their body is attacking itself. And cell-mediated is localized. Right? And this chart just shows the process of a type 1 allergic reaction. Continuing, so immune system targets different molecules depending on the hypersensitivity reaction. In autoimmune reaction, the target is the person's own tissue. Immunodeficiency, the body's immune system is inadequate and resistance to infectious diseases is decreased. Now, factors that cause disease. Factors that can contribute or cause disease include genetic factors, factors within the environment, age, sex-associated factors. Controllable versus uncontrollable risk factors. Uncontrollable factors such as genetics, race, influence the development of disease. Controllable factors, smoking, drinking, alcohol, inadequate nutrition, lack of physical activity, and stress. Risk of particular disease often depends on the person's age. Now, analysis of disease risk. It involves consideration of disease rates and disease risk factors. All studies of a disease should consider the incidence, prevalence, and mortality of the disease. Risk factors, age, and sex differences often interact. Common familial disease and associated risk factors. So true genetic risk is passed through generations by inheritance of a specific gene. Disease with familial tendency cluster in family groups. Immunologic diseases are caused by hyperactivity or hypoactivity of the immune system. Oops. Now, cancer describes pathology associated with malignant growth. So it's abnormal growths of the cell, and it's malignant, it's harmful, or it's replicating quite quickly. Diabetes mellitus, one of the most significant endocrine disease, which has to do with how the body absorbs glucose for energy and metabolic function. There are hemolytic disorders, disorders of the blood, hemolytic anemia, hemophilia, and hemochromatosis. For the cardiovascular disorders, you have cardiomyopathy, mitral valve prolapse, coronary heart disease, hypertension, stroke. For renal disorders, you have gout and kidney stones. Both are caused from inadequate digestion. So whatever remains crystallize and lodge in certain areas. Gout is in the lower extremities or the foot. Kidney stones is in the kidneys. Gallstones is in the gallbladder. Gastrointestinal disorders, you have malabsorption disorders, lactose intolerance, ulcerative colitis, Crohn's disease, peptic ulcer disease, gallstones, obesity. And for neuromuscular disorders, Huntington disease, muscular dystrophy, multiple sclerosis, Alzheimer. For the psychiatric, you have schizophrenia, bipolar disorder. Don't worry too much about what all these disorders are. When we start to look specifically at the medical emergencies, I will go into more detail regarding these conditions. Now, stress and disease. Stress can cause a physiologic response. Physiologic stress, change that makes it necessary for cells of the body to adapt. And the general adaptation syndrome involves 3 stages. Stage 1, which is the alarm stage. Stage 2, which is resistance or adaptation. And stage 3, which is exhaustion. And this diagram is just showing what happens at a physiologic level or pathophysiology as it relates to the brain, the kidneys, and the adrenal gland when stress occurs within the body. Stress triggers the secretion of adrenocorticotropic hormone and cortisol. Cortisol is a type of steroid. Adrenocorticotropic is gonna trigger the sympathetic hormones or chemicals. And when that is triggered, it can have abnormal effects on the body. So we don't want these hormones to be produced when they are not needed. Can cause problems. Now, effects of chronic stress. Hypothalamic pituitary adrenal axis controls the reaction to stress. If the stress continues, this will lead to loss of control, and coping mechanisms play a role in the physiologic response to stress. And that will basically bring us to the end of this chapter. Now, as I stated before, there are a few things that I didn't go into much detail on, and that's simply because they will be covered in other chapters down the line. So don't worry too much about that. Are there any questions at this time? Well, hold on, let me just stop this video. Oh, and the ethanol will affect the cell membrane. So if there is too much ethanol in the body, it can affect the membrane of the cell. And that would be it